Hi. The anterior triangle of the neck is a region located at the front of the neck. Now, it is important to note that these triangles are paired, and for that matter, there is a right anterior triangle as well as a left anterior triangle. The anterior triangle is bounded superiorly by the inferior border of the mandible or the jawbone. It is bounded laterally by the anterior border of the sternocleidomastoid muscle, and it is bounded medially by the sagittal line down the midline of the neck. Now, the roof of the triangle is covered by an investing fascia, while the floor is covered by a visceral fascia. The anterior triangle is subdivided into 4 triangles, and we shall look at them individually pretty soon. The contents of the anterior triangle include muscles, nerves, arteries, veins, and lymph nodes. The muscles in this part of the neck are divided as to where they lie in relation to the hyoid bone. There are 4 suprahyoid muscles, and they are located superiorly to the hyoid bone. Likewise, there are 4 infrahyoid muscles which are located inferior to the hyoid bone. So the suprahyoid muscles include the stylohyoid muscle, the digastric muscle, the mylohyoid muscle, and the geniohyoid muscle. The inferior or the infrahyoid muscles include the omohyoid muscle, the sternocleidomastoid muscle, the thyroid muscle, and the sternothyroid muscle. There are several important vascular structures within the anterior triangle. The common carotid artery bifurcates within the triangle into the external and internal carotid branches. The internal jugular vein can also be found within this area, and it is responsible for venous drainage of the head as well as the neck. Numerous cranial nerves are located in the anterior triangle. Some of these nerves pass straight through, and others give rise to branches which innervate some of the other structures within the triangle. The cranial nerves in the anterior triangle are the facial nerve, the glossopharyngeal nerve, the vagus nerves, the accessory nerve, and the hypoglossal nerve. The anterior triangle is subdivided into 4 triangles, like we said earlier on. Now, the first of these triangles is the carotid triangle. The carotid triangle of the neck is bounded superiorly by the posterior belly of the digastric muscle. It is bounded laterally by the medial border of the sternocleidomastoid muscle, and it is bounded inferiorly by the superior belly of the omohyoid muscle. The main contents of the carotid triangle are the common carotid artery, which bifurcates into the external and internal carotid arteries, as well as the internal jugular vein, the hypoglossal and the vagus nerves. In the carotid triangle, many of these vessels and nerves are relatively superficial, and so they can be accessed easily. The carotid triangle also contains the carotid sinus. This is a dilated portion of the common carotid and the internal carotid arteries. It contains specific sensory cells, which is called the baroreceptors. Now, these baroreceptors detect stretch as a measure of blood pressure. The glossopharyngeal nerve feeds this information from the baroreceptors to the brain, and this is used to regulate blood pressure. In some people, the baroreceptors are hypersensitive to stretch. In these people, or in these patients, external pressure on the carotid sinus can cause slowing of the heart rate and a decrease in blood pressure. The brain becomes underperfused in this case, and syncope may result. In such patients, checking the pulse at the carotid triangle is not advised. The second triangle is the submental triangle. Now, the submental triangle in the neck is situated underneath the chin. It contains the submental lymph nodes, which filter lymph draining from the floor of the mouth and parts of the tongue. It is bounded inferiorly by the hyoid bone, medially by the midline of the neck, laterally by the anterior belly of the digastric muscle. The base of the submental triangle is formed by the anterior belly of the mylohyoid muscle, which runs from the mandible to the hyoid bone. Next triangle is the submandibular triangle. The submandibular triangle is located underneath the body of the mandible. It contains the submandibular gland or the salivary gland, as well as lymph nodes. Now, the facial artery and vein also pass through this area. The submandibular triangle is bounded superiorly by the body of the mandible. It is bounded anteriorly by the anterior belly of the digastric muscle, and it is bounded posteriorly by the posterior belly of the digastric muscle. Now, the fourth triangle is the muscular triangle. The muscular triangle is situated more inferiorly than the other subdivisions. It is a slightly dubious triangle, meaning that in reality it has about 4 boundaries. The muscular triangle contains the infrahyoid muscle, the pharynx, as well as the thyroid and parathyroid glands. The muscular triangle is bounded superiorly by the hyoid bone, medially by the imaginary line or the imaginary midline of the neck, and it is bounded superolaterally by the superior belly of the omohyoid muscle, and it is bounded inferiorly or inferolaterally by the inferior portion of the sternocleidomastoid muscle. Thanks for watching. Please like this video and subscribe to this channel. More videos coming up. See you in the next one.